When entering in a procedure, Gentu provides an array of options to fill in. You can preset procedure templates to make it easier to manage your commonly booked in procedures. Go to Settings on the left, then click on Procedure Templates. To add, click on the plus Add button. Type in the template name, in this example, colonoscopy and gastroscopy. The template name is the name of the procedure that you will select from a drop-down list. When entering in the procedure name, it is recommended that you enter in colonoscopy and gastroscopy as separate items. Type in colonoscopy, followed by tab on the keyboard, then gastroscopy, followed by tab. By entering the name of the two procedures in this way, if the original booking changes where only one of these services are performed, you can easily go into the booked-in procedure and edit the procedure name by clicking on the cross next to gastroscopy in this example, to show that the patient only had a colonoscopy completed as part of their procedure. Enter in a preset procedure note, such as deposit required. By entering this in the procedure note, when you go to book in this procedure, this note will appear as a reminder to take a deposit. Once a deposit has been paid for, it will be easy enough to go into the booked-in procedure and adjust the text to say deposit received. Whereas the pre-op notes found on the right are notes that would print out on the theatre lists that you would normally send to the hospitals. Enter in the relevant billing items, so in this case, 32222 and 30473. If the doctor completes the procedure at different hospitals, or if you have different assistants or anaesthetists, leave these options blank. In addition to the procedure booking details being preset, if the doctor would also like to include preset operation notes, this can be set up in the Operation Notes tab along the top. Enter in the findings, techniques, and post-op orders as necessary by the doctor. However, please ensure that the doctor adjusts and amends these accordingly post-procedure to ensure that the record is up to date and reflective of what occurred during the actual procedure. Once everything has been entered, click on the Save button in the bottom right.